Let me try again. So good afternoon, everyone. This is Connie Burke, Associate Commissioner for Data Management Research and Planning here at OASAS. I'm joined by some of our OSF project management staff, so I'll ask them to introduce themselves. Lou?
Hi, I'm Lucia Perfetti-Clark. I am the project director for the Opioid Settlement Funds.
Great. Kristen?
Hi, everyone. I'm Kristen Lynch. I'm a project coordinator for the Opioid Settlement Funds.
Great. And I will turn to our DOH colleagues who are with us this afternoon.
Hi, good afternoon. I'm Tina Kim. I am the Acting Deputy Commissioner for the Office of Health Equity and Human Rights within the New York State Department of Health. And with me, we have Valerie White from the AIDS Institute. Val?
Good afternoon. I'm Valerie White. I am a Deputy Director at the AIDS Institute. I'm happy to be here this afternoon. Thanks.
Great. Unfortunately, Chris Smith from OMH has another obligation, so he is unable to join us this afternoon. But certainly if any questions or issues come up that fall within his purview, we will be sure to get those questions to him and provide those answers for folks. So really for today, a reminder that we are meeting quarterly, right? Is this our first quarterly or our second quarterly meeting as opposed to monthly? I'm actually going to turn it over to Lucia, who is going to walk through kind of our project updates. And of course, we also will ask DOH to provide updates. And then if there are questions, we'll have some opportunity for a Q&A. So I'll turn it over to you, Lucia.
All right. So is everyone seeing my screen?
Yep.
Yes.
I'm going to put it into presentation mode.
Yep.
Perfect.
All right. So as Connie said, this is now a quarterly meeting. And so we are in the final month of the quarter. So expect to see these in your 2024 calendar year in the final month of each quarter. So March, June, September, December. Man, I did that and I was worried. I was like, after March, it's going to get hairy. Okay, no. So the final month of each quarter next year. Again, I believe we targeted Wednesdays at the same time. So trying to keep it consistent and predictable. And if you're ever not sure, they're always posted on the website. So again, the meeting's being recorded. We heard that. Connie, took us through introductions. Happy holidays, however you celebrate. I read some number that I'll get wrong the other day. That's like, there's, upwards of 70 holidays between October, November, December. So that's kind of fun. We're just trying to give you an overview, be here to answer questions. I was lucky to participate in like a multi-state call about the opioid settlement fund. So I'm happy to report that in New York State, we're being as transparent as we can and trying to share with you as often as we can. So as other states also working to do that as well. So the opioid settlement fund, we wanted to do a little refresher in the event that somebody is maybe new to their job or new to this call, like, why are we here? What are we talking about? So we are addressing this is opioid settlement fund money, New York State's portion of the national settlement. And the national settlement is initially it was over 16 years. It's kind of getting pushed out a little bit with each additional settlement that is settled. So we're looking at a long time of spending these funds. OASAS is the lead agency. Oh, is that me clicking? I'm trying to move my face so that I can see that. There we go. Sorry, it was me clicking. I thought my team was clicking for me. So anyways, OASAS is the lead agency, but we're doing this with our partners at OMH and DOH. We have some additional responsibilities as the lead agency. So collecting, reporting about how the dollars are being spent, and making sure that all the, nitty gritty details are covered in expending the funds. So the actual payments, so OASAS gets to do that. And 2022, $23 were combined. So this is really the first year that we are sending dollars out the door. So reporting will come next, and we're the agency that is responsible for collecting reporting, seeing the status of how the dollars are being spent, and updating the community and the state as to all the great work that's going to get done with those dollars. So that's going to come next year once people have a chance to spend the money. We do this in collaboration with the Opioid Settlement Fund Advisory Board, and their report, actually, to their annual report, is now posted on the Opioid Settlement Fund Advisory Board page. I believe it went up November 3rd. So you can go there for some more detailed reading about their report for this year, their recommendations for this year. It's in-depth report. In that report, you'll find this is the biggest cliff notes you've ever seen. So in that report, you'll see that they've identified 10 categories for right now where they would like to see the focus of the money spent. So these are the 10 categories. In a couple of slides, or if you're familiar with our webpage, you'll see that we broke down the spending also by these categories. And we're staying with these categories, and they decided at their previous meeting sort of how they'd like to see a little bit of a shift in dollars among these categories. And then, of course, we have the regional abatement, which is a substantial portion of the money that will flow through New York State. And that goes right to your LGUs, the 5 large cities, and the other litigating entities. So they are allowed to sort of come up with, within these categories and the allowable use documents that we provided to them, they get to spend the money in the way that best suits their locality. And so what we talk about at these calls is really the money that falls under that box that we've called state operations. Overreaching all of these dollars is these 3 bubbles on the side. So integration, the integration of these services with mental health, which is why OMH is one of our strong partners in this work, equity across all the areas of spending and projects, and then of course evaluating. We want to make sure that what we're doing is effective. We want to hear the story of the good work from everyone who's doing the implementation. So for more reading, and I think I'm seeing Kristen's popping in links into the chat. You can find opioid settlement funding initiatives on this page as we move into 2024. If we have open opportunities, you'll find it on this page. We also have a tracker on our OASAS website that tells you how the dollars have been spent, which RFAs go to which area of spending, and for what amount, and you can see who wins those awards. So the regional abatement, I sort of touched on that a little bit. This is for fiscal year 23. As I said, this is really the first year where money has left the building and hit their accounts. So we asked them to tell us how they plan to spend the dollars, but we understand that they have procurement rules and legislatures, et cetera, to work their ideas through. So you can see on our website by region how the region planned to spend the dollars. Of course, that's subject to change as they work through their own local processes and hear from their communities what's needed. This is likely to shift going into next year when we find out really how the dollars were spent for 23. But we're excited. We've had a lot of great communication with LGUs, help from our local partners. And so 78 of 81 have submitted their plans. And we're going to get those last 3 for sure before New Year's Eve. I know it. Thanks to Kristen. That is all Kristen's boots on the ground. So you can see this information on the tracker as well, but this is how we allocated the dollars over those areas of focus. And then when you go down to the RFAs will tell you which RFA aligns to which area of focus. So I know the governor has been out and about as well. We're pretty proud of it too. It's on our landing page that all $192 million are allocated. Local impact initiative. We're also pretty proud of this. So we were hearing from the Opioid Settlement Fund Advisory Board and from communities that it's really hard, and we know it's hard to apply for and receive state dollars. So we are trying to help our very small 501(c)(3)s, our community partners who do some of the more adjacent or tangential services on a small scale. We wanted to offer them an opportunity. So this was our local impact initiative. We were able to award 18 501(c)(3)s in 11 counties, and stay tuned because I think it's safe to say, Connie, that we're going to be having a round 2 of this. So we were super happy that we really did accomplish finding those very small providers. And the dollar amounts you're seeing are sort of how we categorize the work that they do. So next steps, continue spending the money. So it comes every year. It's gonna be just ongoing. 18, I guess maybe we're 3 years into the 18. My husband's a mathematician. He likes to say counting is hard. So I think counting is hard when it comes to litigation years, budget years, but we're going into fiscal year 24. I'm going to call it year 3. And you're going to start to see evaluation of the projects online. We're gearing up for a lot of public facing information, Tableau dashboards and visualizations of how the dollars are going to be spent, the geography of how the dollars are going to be spent. So we're excited, and keep checking back in our website and keep coming to this meeting because I'm sure we'll want to share with it. And just continued coordination and collaboration with our partners and local entities. So Tina, I think you're next.
There we go.
Thank you. I do not have a PowerPoint with all of the detail, but thank you for creating one for the Department of Health to provide verbal updates at today's meeting. So I am happy to share several updates related to the Department of Health's efforts when it comes to this funding. So first, related to a new contract with the New York State Association of Counties with respect to the coroner and medical examiner work, we are in the process of working directly with the counties to pay for expenses related to coroner and medical examiner work through individual purchase orders. Because we hit a snafu when it comes to the contract between us and NYSAC. So we are working directly with the counties to make sure that the work is paid for and recognized through this funding. Just wanted to provide a quick update on 25 contracts related to the expansion of New York State drug user health hubs and syringe service programs. It's a total of $12.59 million and some change. The contracts are under development. 20 of the 25 contracts that are needed to be in place have been sent to the New York Attorney General's office and the New York State Comptroller's office and are pending their review and final approval. Invoices will start coming in to be processed and paid within the next month. So we are eagerly kind of awaiting for final approval to take the next steps with respect to our drug user health hubs and syringe service program funding. With respect to the department's contract with AMFAR, the Foundation for AIDS Research, related to harm reduction supplies, our contract on harm reduction supplies was amended and the funds have been spent. So happy to report that there, and that is a total of $1 million. Next, wanted to provide a quick update on a solicitation of interest that the department released related to the provision of harm reduction services via telemedicine. This was a total of $1 million, and the intention was to expand telemedicine for treatment of opioid use disorder. The respective contract reporter exemption request, or CREER, that's the acronym in state speak, the B1184, which allows us to get approval all the way up to the Division of Budget, and our internal approvals within DOH are all pending in order for us to proceed and write a contract. And we are expecting for the contract to begin on May 1st, 2024. Next, I wanted to provide a quick update on the request for applications. The intent was to award 1 to 2 new contracts related to the development of a comprehensive coroner training program in New York State. As you recall, this was to develop a training program which would have provided fundamental information to new and existing coroners with a focus on drug overdose related death investigation. The applications were due October 5th. Unfortunately, no applications were received, so the AIDS Institute here within the State Department of Health is pursuing other options at this time. Another request for applications that was recently released was the expanding harm reduction services for priority populations who use drugs. As a reminder, the intent of this RFA was to allow for syringe exchange programs, drug user health hubs, and community-based organizations to enhance culturally informed harm reduction services for Black, Indigenous, and people of color at places where they will feel accepted. The applications are under review. The funding recommendations will be made by the end of January once the review process is completed. With respect to the department's contract on New York Matters, medication for addiction treatment and electronic referrals, or in short, New York Matters program, that contract is currently under development. And the intention there is to contract with the University Emergency Medical Services through the University of Buffalo to expand the New York section of this secure patient data exchange system. And lastly, a quick update on naloxone. We are in year 2 of our renewal of our emergent devices contract for the purchasing of naloxone for the period August 1st, 2023 through the end of July 2024. State-based funding needs to be spent before we can use the settlement funding. That contract is currently with the Attorney General's office and the State Comptroller's office for final review and approval. And I'm happy to close out there in terms of the Department of Health updates, and we're happy to field any questions when they arise. Thank you.
That's
Awesome.
great. Thanks, Tina. Awesome to see the work moving along. So thank you for that update. And to the extent that there's any of that information that we can make available on our Opioid Settlement Fund tracker, OASAS will also update our webpage to reflect information where contracts are executed or awards have been made. So at this point, if folks have questions, I invite you to enter your question into the chat. We have a big group, but not an unmanageable one. So certainly if folks want to or raise their hand, and I think that Lucia, folks would be able to see that, but probably chat is the best option for submitting your question. So do folks have any questions at this point that they'd like to pose?
All right, so I see, is 2023 funding closed? And we would need to return for 2024 opportunities. Yes, yes. So there are no active RFAs on our page right now, but stay tuned. Always check that page. And, you know, as soon as opportunities are available, we update that. That's where they go.
Yeah. No other questions? Maybe it was the level set that you did, Lucia. Made sure everybody's on the same page, everybody has the information. Reminder as to why we're here, what brings us here together today. So OASAS does continue to meet with the LGUs and the other litigating entities that receive dollars through the regional abatement. Know that work continues. It is ongoing. I'm trying to think. What else can I say while we see if there are any other questions?
There were a couple of other questions that came through the chat. So there's one about reporting. When do we need to report? So Colleen, actually, if you don't mind emailing the OSF project management inbox, so we can speak specifically to what you have a contract for, because those report dates are different depending on the project. Right. And then what specifically are the recovery funds intended for? As specific as the national settlement gets, they are for opioid abatement. So abatement of future harms from opioid use disorder. Obviously that's pretty broad. So that's why we have the advisory board provide those 10 categories. And then, you know, we were in the business of doing prevention, treatment, recovery before the opioid settlement fund. So we tried to align those buckets to the work that's already being done and to see how we can expand it in a way that's meaningful. Is there, let's see, is there an average grant size from 2023? I'm not certain that an average would be super meaningful in terms of each RFA is written with that specific project in mind. So the annual amounts are different per each RFA. I can say the regional abatement is awarded based on population. So those dollar amounts are relative to the population of those counties, cities, other litigating entities, if that's helpful. DOH, please comment on coroner training and having no applications. Does that mean there are no applications from potential trainers?
Yeah, so I'm happy to answer that. Thank you. So you are correct. You know, the intent was, you know, the idea was to award 1 to 2 entities that would, you know, come up with a training program. So no applications were received. We have to receive it officially and formally through the request for application that we had released. But it doesn't necessarily mean that there's no training program out there, or, you know, it's just they didn't respond to the specific request for applications. So we'll be having kind of continued internal conversation and with our partners to figure out what other options make sense with respect to this with this pot of money. Val, is there any detail that I missed, or just want to make sure that I answered Trevor's question fully?
No, Tina, I think you've got it. We're going to just look into a little bit more to see if maybe we need to, you know, change the RFA a little bit or scale it down a little bit, and, you know, potentially reissue it soon to see if we can get applications this time. But we're looking into it a little bit more to see what would be most advantageous to move forward in that manner.
Thank you, Val.
And then, oh, sorry, Connie, there's a question about, can you tell me how many dollars were allocated to inpatient care? We've had a bed shortage. It's difficult to get people into treatment.
So that isn't a question that we can really answer, right? So the dollars were allocated based on an amount per category, per the 10 high priority categories identified by the board. And then in terms of the actual RFAs and the opportunities we've made available, I can't, a quick scan in my head, none were targeted to inpatient care specifically.
And then it says, when in 2024 would we expect for RFAs to open? Early in the year, question mark?
That's a great question. So with regard to the 2024 appropriations, we have gotten approval to spend, which is great. And I expect that our first efforts will be geared towards workforce. That's what we've already been working on and talking about. In terms of making any funding opportunities available, I do expect that you'll see activity in January. And obviously, the work isn't limited to workforce. We do have dollars, again, across the 10 priority categories, and we will be working hard to make those dollars available just as quickly as we can. And who knows, maybe we'll beat 2023 funding efforts and make them available sooner than within 8 months, which was pretty impressive, and see if we can't make the dollars, all the dollars available sooner. So stay tuned. So, Lucia, are you still reading the questions?
Yeah, sorry. Just call me Jeff Beetle. Sorry. So any consideration to pain management RFPs focus being considered? Have not heard conversation about that. Not sure how it fits. Pain management. Yeah.
Nothing on the OASAS side. Is there anything on the DOH side around pain management? Okay, so not at this time.
And then sort of a specific question. So Charlotte, I'm going to ask you to send an email again to the OSF project management inbox. What happens if we don't spend it by the end of 2023? So this answer is also contract location dependent. So in terms of, you know, giving people fiscal answers, we want to be specific and correct. So if you can send an email to the project management inbox, we can help you with that.
Mm-hmm.
In terms of opioid settlement fund dollars, those are with the state. They don't disappear. So New York State, once New York State is paid from the National Settlement Fund, we have those dollars.
Okay. So the question about carryover for unforeseen circumstances, most definitely that should be directed to the OSF mailbox. Please provide the initiative and information about which project specifically you're asking about. It's amazing. I think that I've learned over the last year that we can't complicate things enough, especially when it comes to, you know, this is one of multiple funding streams that that we manage and make available to providers and to the system. And there always seems to be a little bit of a nuance with a given funding stream in terms of the award period, the availability, you know, because these are dollars that flow through the state, also want to try to coordinate with your annual budgets and the state fiscal year. So really, it's best to have a one-on-one conversation about anything like you're asking. Go ahead. Sorry.
Yeah, so with regard to the workforce titles or eligible applicants, I guess all I can say broadly is that we understand the workforce exists from the top to the bottom, right? So it's multi-layered, multifaceted, and we're trying to make sure that our approach has something for everyone. Connie, anything you want to add there?
No other detail I can provide at this time, but stay tuned. Definitely more information will be available in January.
Are the funding also available for for-profit providers? I feel like 12 months later, I can answer this question. So directly from the state, no. However, regional abatement funds are subject to their localities rules. So if your LGU or your city or your other litigating entity has no restriction on providing $1 to a for-profit entity, then that is really the best place to seek out opportunities. And I love this one. Yay, Destin's House. So they're an awardee under local impact. Is there a media consultant for those who received funding? Yes. So we definitely want to hear the story of what you're doing and how the funding is having an impact. You can use that OSF project management inbox, and we will definitely get you connected with our communications teams. And for anyone on the call who has funding, if you have local press, please send it to us and share it with us. We also want to make sure everyone knows about the work that you're doing.
Yeah, and another good reason to share in the good work and let us know what's happening. You know, where we identify opportunities to showcase through our media outlets, the work that is happening, we're more than happy to do that. And so I really do encourage folks to reach out and let us know how the dollars and the services are impacting the local community. To the extent that there is local media, fantastic. But even the stories that you can provide, the examples that you have, to the extent that people are interested in talking about how the work has impacted them or made a difference in their life, we certainly want to hear, and that is something that we would want to share more broadly and talk about.
Do you want to take this question, Connie, about the psych nurse practitioner?
Yeah, sure. So here's a question specifically asking because the system has a need to educate faculty for psych nurse practitioner PhD programs to address the workforce needs for PNPs. And would there be tuition support eligible for the upcoming workforce funding? So I'm going to harken back to what Lucia said in terms of workforce and the need. It's like top to bottom, and it's folks at every level. So we are looking to make tuition reimbursement opportunities available more broadly. And again, we'll have more information about what that looks like exactly in January. And thank you, Carrie, for the applause there. And there's a question, can you please recap the New York matters?
So there's, yeah, I don't know, Tina, if that's for you, what you talked about New York matters, patient data exchange, or?
My WebEx is freezing on me. Val, do you just want to give a brief update just in terms of background on the Matters program?
Yeah, the Matters program started a few years ago, back in like 2017, actually making immediate connections to people in EDs to get on buprenorphine and then connect them while they're in the ED to follow up services. So it started in Buffalo with just a couple hospitals, but it's now a statewide program. So, and it's really expanded, over the years. So there's an award this year, as Tina mentioned, that the contract is under development for $8 million over a 2-year period for that program. I hope that answers the questions. If not, I'm happy to, if somebody puts it back into the email that's up there, and OASAS could forward it to us and we could provide more specific details if helpful. Thanks.
So there is a question about the amount allocated for workforce funding. And so it's interesting to ask the question because in fact, it's not of the 10 priority areas identified by the board, there isn't one that is workforce in and of itself. And so in fact, workforce is an aspect of everything that we're doing with the opioid settlement funds. And the board, in fact, has asked that we really think about workforce in terms of every initiative that we're looking to fund and how can workforce be addressed by way of that initiative. So I can't say that there's specifically, an amount that's been identified by the board or because of the high priority areas, but know that we are looking at workforce specifically in and of itself. How can we support the workforce? And we will also be looking at workforce through each of the initiatives. I don't have the dollar amount in front of me in terms of the workforce initiatives that we're looking to release for 2024, but stay tuned. With every release, we do let you know what the total amount is that's available. And then I see that there's a comment. It's great to see the media releases so that folks can get ideas from them as well. So I encourage everyone to follow us on X and on Facebook. For those of you who also are part of LinkedIn, know that our communications department regularly posts on activities and the commissioner's goings on about the state, work that's being done, and actually initiatives that are made available. We do use our social media outlets to make that information known. And also, in terms of our podcast, which is another way that we are trying to share information with, with the whole state in terms of the work that we're doing, the important issues that we're addressing as a state agency, and certainly also sharing opportunities where individuals can talk about the impact that services and the work has had on them. So if you haven't tuned into the podcast, I encourage folks to do that. I don't know if any of the OASAS folks have a link to the podcast that they could drop into the chat. You could certainly go to the OASAS main webpage and find information on the podcast. So you could find some good news stories there, as well as, again, following us on all of those social media outlets that I mentioned. And then just a reminder, so question with regard to for-profit providers. For folks to be aware, the opioid settlement funds are dollars that actually flow through the state. And as such, and based on mental hygiene law, state dollars cannot go to for-profit entities. So any funding that flows through the state needs to be directed to not-for-profit entities. And this is why, it's really important, even for, when we were talking about the local initiatives, for entities that want to apply for funding to be a 501c3, and as such, you are eligible for funding, and then also in a position to be able to enter into a state contract, although not necessary, depending on the initiative and the, how we're making dollars available. But it is a requirement, and it is stated, it's out of OASAS's hands. We cannot use these dollars to support for-profit entities. Oh, thanks, and Denise did drop the podcast link in the chat, so please avail yourself an opportunity to log in and listen to one of the Next Step podcasts that we make available. There are more than a few now, so you could actually get caught up if you go through that link.
Yeah, we did one on the local initiative, so you could go back and listen to that one since it's coming back around again. There's an addiction, the addiction scholarship program is also one of the podcasts.
Oh, nice. Excellent. Okay, so I just admitted I'm a little behind on my podcast because I didn't know about that one. All right, I missed that one. Thanks, Lucia. Any other questions that we see popping up? Nothing, Lucia?
Nope. So we do post these recordings to the same place where you can find when the next meeting is. So you can just check that website. We also post the recordings to the regional abatement calls as well. So if you're looking to partner with your local LGU, or you just want to know where that group of folks is at with their opioid settlement funds, you can find those recordings on the webpage as well.
All right, so if there aren't any other questions, as Lucia had said, our next meeting will be in March. I expect that there will be a lot of updates in March. It gives us, 3.5 months to get some work done, 3 months to get some work done. So I'm already looking forward to providing updates and talking about funding opportunities we've made available and kind of what's in the hopper. I appreciate everybody logging in and joining us for this call. Thank you to our partners at DOH for joining and providing an update on our 2023 appropriations, and stay tuned to hear about 2024. Take care, everybody.
Thank you.